Hi everyone, I'm Kelsey Meehan with Alberta Health Services Communications, your host of Health Matters. I'm joined now with Dawn Dick. Dawn is a registered public health nurse, and Dawn and I are going to be talking a little bit about screen time, what it is, and how screen time affects children's health. Thanks for joining me, Dawn.
Thank you.
So can you talk a little bit about exactly what screen time means?
Okay, so screen time is really any time in front of a screen, so it can be internet use, television, gaming, iPads, any time that children are in front of a screen.
Okay. And how much time is recommended for children, I guess, at different ages to be allowed to be in front of screens?
Okay, so the most important thing to remember is that the first 2 years of development for an infant happen, in those first 2 years of life. And so anytime that they're in front of a screen, it's actually hindering the time that they can be interacting with parents and others and furthering their development, whether it's in speech or just interactions that would help promote their gross motor or fine motor development.
Okay, and what are some of the outcomes, I guess, that you've noticed or that you know of that occur in children that spend more than that recommended screen time?
So it's important to know that for school-age children or older children, the Canadian Pediatric Society actually says that you can have 1 to 2 hours a day, but less time is better. Again, just to have more of the interaction with peers as well as parents, but outcomes that result from more than that time. So for example, if a child is spending about 4 hours a day in front of the television, there's an increased likelihood of obesity. There's also links to anxiety and depression. As well, with the television programs, there can be risky behaviors that are depicted, like smoking, drinking, sex, and so all of those things can impact values of the children viewing them. Also, violence can be something that can cause children to feel like their world isn't safe, or promote aggression as well.
Okay, so how can, I guess, parents then and children develop healthy screen time habits then?
So the biggest thing would just be to limit the number of hours spent in front of the screen. So whether it's computer use or the television itself. Also setting out a schedule for the family of how much time is allowed, and treating TV as more of a privilege to be earned after chores and homework is done. As well as not having TVs or gaming systems in bedrooms is a huge thing. Mm-hmm. Same thing with just turning off TV during meal time so that it is family time, it's an interactive time. And also just balancing TV time with other activities like sports or hobbies or crafts.
Okay, and because we do live in such an electronic age and there are so many screens out there and so many of those tools, what are some alternates that people can turn to instead of the TV or the iPad and things like that?
Okay, so often what's recommended is having board games, other toys that kids can play with in the room where there's a television or computer screen, so that there are other options, like coloring books are good for children as well. Also just going outside and playing. We're in winter season right now. You could certainly go to a hill and do tobogganing or skating, skiing, just taking advantage of the seasons as well for outside activities, just to promote also that physical activity.
All right, well that sounds great. Thanks for joining me, Dawn.
Thank you.
And thanks for watching, everyone. Thanks for tuning in to Health Matters. Don't forget to turn off your TVs and just try and spend more time with your families.